Welcome to Pharmaverse 321, where science meets clarity. Today, we dive into one of the most trusted names in antibiotics, Augmentin 625 Duo, a powerful combination of amoxicillin and clavulanic acid designed to fight infections that resist ordinary treatment. Whether you're a healthcare professional or a curious learner, this guide is your one-stop resource. Let's decode the science behind this broad-spectrum warrior. Stay tuned, subscribe, and let's elevate your pharma knowledge. Let's break down what makes Augmentin 625 Duo so effective. It's powered by two active ingredients: amoxicillin, a broad-spectrum penicillin antibiotic that targets bacterial cell walls, and clavulanic acid, a beta-lactamase inhibitor that shields amoxicillin from bacterial resistance. Together, they form a dynamic duo, fighting infections that ordinary antibiotics can't handle. Augmentin comes in multiple formulations to suit every need. Immediate-release tablets in 250, 500, and 875 milligrams, extended-release tablets at 1,000 milligrams, oral suspensions for pediatric use, and chewable tablets for children. From clinics to homes, Augmentin adapts to every patient profile. Let's decode the science behind Augmentin's dual-action power. First, amoxicillin targets the bacterial cell wall, disrupting its structure and stopping the bacteria from multiplying. But here's the twist. Many bacteria fight back by producing beta-lactamase enzymes that destroy antibiotics. That's where clavulanic acid steps in. It blocks those enzymes, protecting amoxicillin from being neutralized. Together, they eliminate even resistant strains, making Augmentin a go-to weapon in modern antimicrobial therapy. This synergy broadens its spectrum and boosts its clinical impact, especially in infections where resistance is a concern. Let's explore where it shines in clinical practice. In respiratory infections, it's a frontline choice for acute sinusitis, community-acquired pneumonia, otitis media, and chronic bronchitis flare-ups. In skin and soft tissue infections, it tackles cellulitis, abscesses, diabetic foot infections, and even bite wounds, both human and animal. And beyond that, Augmentin is trusted for other serious infections like UTIs, dental abscesses, bone and joint infections, and intra-abdominal complications. Its broad-spectrum coverage and resistance-fighting formula make it a go-to antibiotic across specialties. Let's talk dosing, because precision matters. For adults with mild to moderate infections, the standard dose is 500 milligrams every 12 hours, or 250 milligrams every 8 hours, typically for 7 to 10 days. In severe infections, the dose increases to 875 milligrams every 12 hours, or 500 milligrams every 8 hours, and treatment may be extended. For specific cases, extended-release tablets at 2,000 milligrams every 12 hours may be prescribed. Now for pediatric patients, dosing is based on body weight. Standard, 25 to 45 milligrams per kilogram per day, divided every 12 hours. High-dose regimens go up to 90 milligrams per kilogram per day for resistant infections. But remember, pediatric doses should never exceed adult limits. Oral suspensions are available in multiple concentrations for flexible dosing. And in cases of renal impairment, dose adjustments are essential. Always consult prescribing guidelines before initiating therapy. Get the most out of Augmentin. Proper administration is key. Step 1, always take it with food. This boosts absorption and reduces stomach upset. Step 2, complete the full course even if you start feeling better. Stopping early can lead to resistance. Step 3, stick to a consistent schedule. Taking doses at evenly spaced intervals helps maintain effective blood levels. Step 4, if you're using the liquid suspension, shake it well before each dose and refrigerate it after mixing. Step 5, don't skip doses. If you miss one, take it as soon as you remember, unless it's almost time for the next. These simple steps ensure Augmentin works safely and effectively. Like any medication, Augmentin can cause side effects, but most are mild and manageable. The most common is diarrhea, seen in up to 25% of patients. It's usually self-limiting and improves with probiotics. Nausea affects around 3 to 9%, and taking Augmentin with food helps reduce it. Vomiting occurs in 2 to 6%, more often in children. Skin rashes are rare, just 1 to 3%, but always monitor for allergic reactions. Other possible effects include abdominal discomfort, yeast infections, headaches, or dizziness. To manage these, white heavy checkmark take probiotics to ease GI symptoms. White heavy checkmark stay hydrated throughout treatment. White heavy checkmark, and if symptoms persist, consult your doctor. Augmentin remains one of the most well-tolerated antibiotics when taken correctly. While Augmentin is generally safe, some reactions demand immediate attention. Let's start with severe allergic responses. If you experience difficulty breathing, swelling of the face or tongue, or a widespread rash with fever, seek emergency care. Next, watch for signs of liver problems, yellowing of the skin or eyes, dark urine, pale stools, or unexplained fatigue. And don't ignore intestinal red flags, persistent or bloody diarrhea, severe abdominal cramps, or fever with gut symptoms. One critical warning: C. difficile-associated diarrhea can occur during or after treatment. If symptoms escalate, contact your healthcare provider without delay. Safety first, always. Before prescribing or taking Augmentin, there are key precautions to keep in mind. Let's start with drug interactions. It may reduce the effectiveness of oral contraceptives, so use backup protection. If you're on warfarin, monitor your INR closely, as bleeding risk may increase. Allopurinol can raise the chance of skin rashes, and probenecid may prolong amoxicillin's action. Now, the contraindications. Avoid Augmentin if you've had allergic reactions to penicillins or cephalosporins. A history of cholestatic jaundice with Augmentin, or if you have severe renal impairment or infectious mononucleosis. For special populations, in pregnancy, it's category B, safe when clearly needed. During breastfeeding, it passes into milk, so monitor the infant. And in elderly patients, renal function should guide dosing. These precautions ensure Augmentin is used safely and effectively. Let's wrap up with the essentials for safe and effective use of Augmentin. First, complete the full course. Stopping early can lead to resistance and relapse. Second, take it with food. This improves absorption and reduces stomach upset. Third, report any allergies, especially to penicillins or cephalosporins, before starting treatment. Fourth, store it properly. Keep tablets at room temperature and refrigerate the liquid suspension. Discard it after 10 days. And remember, if you have questions or concerns, always consult your doctor or pharmacist. This guide is educational, not a substitute for professional advice. Stay informed, stay safe, and keep learning with Pharmaverse 321.